The USMLE Step 1 is a critical milestone on your journey to becoming a physician. Think of Step 1 as your passport to residency programs. It's one of the first things residency program directors consider. A strong performance can open doors to prestigious programs. It demonstrates your understanding of fundamental sciences. These principles guide you in making sound clinical decisions. Let's break down Step 1. It's the first of 3 exams in the USMLE sequence, typically taken after your second year of medical school. Step 1 assesses your basic science knowledge in clinical scenarios. It's a one-day computerized exam taken at Prometric centers, divided into 7 60-minute blocks, with 40 questions per block. You have 8 hours to complete the exam, including breaks. The content is organized by organ systems. Questions test your integrated understanding of these systems. Let's walk through what you can expect on exam day. Knowing the logistics can help calm pre-exam jitters and allow you to focus on demonstrating your knowledge. Ensure you've located your Prometric testing center beforehand and planned your travel. Upon arrival, you'll go through a check-in process, presenting your ID and confirming your registration. You'll be provided with a locker to store your belongings. Only your ID and a provided whiteboard are allowed in the testing room. You'll be escorted to your assigned computer workstation. The testing room is quiet and controlled to minimize distractions. Noise-canceling headphones are provided to minimize external noise. Familiarize yourself with the computer interface, adjust screen brightness, and practice using the digital notepad. Take a moment to settle in, take deep breaths, and remind yourself of your preparation. Remember, Step 1 is a marathon, not a sprint. Pace yourself and use your break time wisely. Understanding the format is crucial for navigating the exam. You'll encounter 280 multiple-choice questions across 7 blocks. Most questions start with a clinical vignette. This vignette provides key information about the patient's history and symptoms. Your task is to analyze this information. Following the vignette, you'll find the question's stem. It might ask for the most likely diagnosis or next step in management. Each question is a one best answer format. Select the single best answer based on your knowledge. Step 1 assesses clinical reasoning, not just recall. Integrate knowledge from different disciplines and apply it to clinical scenarios. Let's break down a Step 1 question. The patient case provides key details about medical history, symptoms, and exam findings. Focus on age, gender, and medical history. The question stem asks something specific based on the vignette. You'll have 5 answer choices. Only one is the best response. Distractors are meant to mislead. Identify the correct answer to succeed. Approach questions strategically to improve your chances. Our first example falls under the category of cardiology, a fundamental subject on Step 1. A 65-year-old male presents with sudden onset of crushing chest pain radiating to his left arm. He describes the pain as tightness and pressure, like an elephant is sitting on his chest. The pain began 30 minutes ago while mowing the lawn. He is also experiencing shortness of breath, sweating, and nausea. His medical history includes hypertension, hyperlipidemia, and a 30-pack-year smoking history. He takes medication for hypertension and high cholesterol. On examination, he appears anxious and diaphoretic. His heart rate is 110 beats per minute, and his blood pressure is 150/90. An ECG shows ST segment elevation in leads 2, 3, and AVF. Which of the following is the most likely diagnosis? A. Stable angina. B. Unstable angina. C. Acute pericarditis. D. Inferior wall myocardial infarction. Or E. Aortic dissection. Consider the answer choices before we move on to the explanation. The correct answer is inferior wall myocardial infarction. The patient presents with classic symptoms of acute coronary syndrome. Risk factors include hypertension, hyperlipidemia, and smoking. The ECG shows ST segment elevation in leads 2, 3, and AVF. This indicates a coronary artery blockage. The ECG findings confirm myocardial infarction. This integrates clinical presentation, risk factors, and diagnostic findings. Identify the most likely diagnosis based on the information provided. Let's dive into an endocrinology question for Step 1. A 30-year-old female presents with increased thirst, frequent urination, and unintentional weight loss. She also reports fatigue and blurred vision. She has no significant medical history and takes no medications. Her vital signs are normal, no other significant findings on exam. Lab tests show a fasting blood glucose of 250 mg/dL and a hemoglobin A1c of 10%. What is the most likely underlying mechanism? A. Autoimmune destruction of pancreatic beta cells. B. Insulin resistance in peripheral tissues. C. Excessive glucagon secretion from the pancreas. D. Increased glucose reabsorption in the kidneys. Or E. Deficiency of glucose 6-phosphatase in the liver. Consider the answer choices before we move on to the explanation. The correct answer is autoimmune destruction of pancreatic beta cells. Classic presentation of type 1 diabetes mellitus. Clinical signs include polyuria, polydipsia, and polyphagia. Also, weight loss and fatigue. Lab results show elevated fasting blood glucose and hemoglobin A1c. Recognizing the autoimmune basis aids in selecting the correct answer. Step 1 covers nearly every organ system. Some organ systems are high yield for Step 1. These systems are foundational for understanding medicine. Key systems include the cardiovascular system, crucial for Step 1 success. Expect questions on coronary artery disease and heart failure. The respiratory system covers COPD and asthma. Apply your knowledge of pulmonary physiology. The gastrointestinal system's digestion, absorption, and elimination. Topics include inflammatory bowel disease and liver cirrhosis. Focusing on these high-yield systems can bolster your Step 1 preparation. Focus on high-yield topics in each organ system. Key areas include myocardial infarction, asthma, and diabetes. Know their pathophysiology, clinical presentation, and management. Master these to excel in Step 1. Step 1 assesses your ability to integrate knowledge from different areas of medicine. You'll face questions that require connecting various organ systems and applying knowledge to clinical scenarios. For example, a patient with diabetes, hypertension, and coronary artery disease might be presented. You may need to identify the cause of symptoms, predict complications, or choose the best treatment plan. Study in a way that fosters integration and application of knowledge. Understand the connections between concepts and their clinical relevance. Use practice questions and case-based resources to strengthen your integrative skills. Focus on high-yield organ systems, master key topics, and practice integrating knowledge. Consistent effort, strategic studying, and deep understanding are key to success. Find the resources that best suit your learning style. Invest in a high-quality review book series. These books provide a comprehensive overview and practice questions. Popular choices include First Aid, Pathoma, and Kaplan. Supplement your studies with a question bank. UWorld, Kaplan QBank, and RX USMLE. Step 1 QBank are highly regarded. Online resources are invaluable. Websites offer video lectures and flashcards. Popular choices include Sketchy Medical, Picmonic, and Osmosis. Create a personalized study plan using available resources. Assess your baseline knowledge to identify strengths and weaknesses. Take a diagnostic exam early in your preparation. Allocate study time based on your needs. Break down study time into manageable chunks. Use concentrated study sessions for better retention. Regularly incorporate practice questions. Of course, ensure adequate sleep, exercise, and a healthy diet. Take breaks to recharge. Let's discuss strategies to excel on exam day. Effective test-taking skills are crucial. Familiarize yourself with the exam format. Practice using the digital notepad. Manage your time effectively. Pace yourself and avoid getting stuck. Flag difficult questions to revisit later. Read questions carefully and identify key concepts. Use elimination to find the best answer. Practice relaxation techniques to manage anxiety. Approach the exam with confidence. From cardiology to endocrine, we explored common clinical presentations and key considerations. Focus on high-yield areas, but ensure a well-rounded understanding of all organ systems for Step 1 success. Acing Step 1 is a significant accomplishment, but it's just one piece of your medical journey. Becoming a physician involves more than exams and scores. Volunteer at clinics, shadow physicians, or participate in research projects. Connect with patients, understand their perspectives, and develop your clinical skills. These experiences will enrich your understanding of medicine and shape you into a compassionate physician. Step 1 is a challenging but surmountable hurdle. As you embark on this next chapter, remember you are capable of achieving great things. Congratulations on taking this significant step and best of luck on step 1.